Some breaking news to bring you now. Buckingham Palace has issued a statement saying King Charles will be in hospital next week. I'll bring you the statement in full now. It says, in common with thousands of men each year, the King has sought treatment for an enlarged prostate. His Majesty's condition is benign and he will attend hospital next week for a corrective procedure. The King's public engagements will be postponed for a short period of recuperation. So that statement has just come through in the past few minutes from Buckingham Palace. Just to reiterate, the King is attending hospital next week, and as the statement said, it's for a corrective procedure. They say it's for an enlarged prostate, and it says, understandably, that the King's public engagements will be postponed for a short period of recuperation. And they've also added that the condition is benign. Well, let's find out more from our royal correspondent, Sarah Campbell. Now, Sarah, we earlier had the news about Princess Catherine and her surgery. Now we are hearing a statement from Buckingham Palace about King Charles going in. This is, I know, something that's only come through in the past few minutes, but is there anything else we know at this stage?
Yeah, as you say, already had the announcement about Catherine, Princess of Wales, and now the King. I think it's just worth, if people are just tuning in, to take us through that statement. Again, the King is seeking treatment for an enlarged prostate. So His Majesty's condition is benign, but he will attend hospital next week for a corrective procedure. And in case people are thinking, why announce it today? Because obviously we're just kind of getting our head around the fact that the Princess of Wales has had a abdominal surgery. That was announced at around 2 o'clock this afternoon. The reason for that is because the King had a number of engagements tomorrow and Friday at Dumfries House in Scotland, which are now being postponed on doctor's advice. So obviously whenever a member of the royal family, particularly the King, pulls out of engagements, questions will always be asked, and so they are putting this information out there to answer those questions before they are asked. I should also say that the Palace have made it clear that I think this is that the diagnosis was wanting to be shared because obviously, as we know, prostate issues for men of a certain age, the King is 75, are a big issue, and keeping a check on these things are very important. And I think His Majesty wanted to share this diagnosis, if you like, in order to, as a sort of bit of a public service announcement, but primarily people will be worried because he will have pulled out of engagements tomorrow, and so that was why the announcement is made today. But coming off the back, as it does, of the announcement about Catherine, the Princess of Wales, we were talking about that earlier in the programme, weren't we? She was admitted to the London clinic yesterday for planned abdominal surgery, and she is expected to stay in hospital for around 10 to 14 days.
And her public engagements also being put off because, of course, the timetable and the scheduling is not compatible at all with recovery, is it, with recuperation, the strain and the workload of these royal engagements and the travel involved? Yeah,
absolutely. And I think it's fair to say that were these things not happening, then the royals would be preparing to get back out on the road after their sort of Christmas break. And so clearly that is now not going to happen either for the Princess of Wales, but also we know that Prince William is going to be helping, her recovery. She will be heading back to Windsor when she is discharged from hospital. He will be helping to look after her. Obviously, they have 3 young children, so I think we won't expect to see the Prince and Princess of Wales until that recuperation is really underway. But yes, the King as well. We haven't got a time scale as to when he is going to be back out carrying out engagements, but clearly he's going to be out of action for the foreseeable.
And just to jump in there, Sarah, what viewers are seeing at the moment, these are live pictures from the hospital where Princess Catherine is staying at the moment. This is the hospital where she is currently recovering from abdominal surgery there, the hospital that you mentioned. And do we know how full and how busy the royal timetable of events was for the foreseeable for both the Princess of Wales and the King?
Well, engagements for security reasons, they're not sent out, announced far in advance. So you tend to know with a few days' notice. So you won't necessarily know. Obviously, those places that would have been expecting them would have known. So this news will have been communicated to them as well. But obviously, it's still relatively soon that the king was crowned, and so he's still sort of making his impact as the king. So I think there would have been foreign trips planned this year. I think the same is true for the Prince and Princess of Wales. But I think we have to say that all of that is now on hold because, their health comes first.
Well, Sarah, thank you so much for bringing us up to date there. That's our royal correspondent, Sarah Campbell. And just to reiterate for those of you just joining us, the statement from Buckingham Palace has been issued in just the past few minutes saying that King Charles will be attending hospital next week. He has sought treatment for an enlarged prostate and he'll be in hospital next week for a corrective procedure. And the condition is benign and his engagements will be postponed for a short period of recuperation.